Good day everyone, I am Jamil V. Manalo, your practical nursing student for today. I am here to perform a return demonstration of LEOPOLD'S maneuver. Before we begin our demonstration or our assessment, I will explain what is LEOPOLD'S maneuver, equipment that we use in our assessment, and things that do not forget in your patient. First, what is LEOPOLD'S maneuver? LEOPOLD'S maneuver are used to palpate the gravid uterus systematically. This method of abdominal palpation is of low cost, easy to use, and non-invasive. It is determined to the presentation, position, and engagement of the fetus in the uterus. Equipment that we use in our assessment is stethoscope, gloves, tape measure, and then small pillow and roll towel. Things that do not forget in your patient: always wash your hand before and after go to your patient. Second, protect the privacy of your patient. Third, make sure all the equipment is all gathered and sanitized. Good day, Miss Paula Juarez. I am Jamil V. Manalo, your practical nursing student for today. I am here to assess to you. For verification, ma'am, can I ask your name and your birthday?
Paula Juarez. From 17,
Okay, ma'am, Paula. How would you like to call you, Miss Paula Juarez?
Paula.
Okay, Miss Paula, I am here to present to you the LEOPOLD'S maneuver. Allow me to explain what we'll be doing for this day. LEOPOLD'S maneuver has a 4 maneuver or 4 grips. It is important to us to know the fetal lie of your baby or fetal presentation of your baby into your womb. Is that okay with you, Miss Paula? Okay. You need urinate first before we start our assessment in our restroom so that we will be not comfort with you while we are start our. Let's start our assessment. Place woman in a dorsal recumbent position with supine knee flex. To relay abdominal muscle and then provide small pillow, put her in the back so that will not cause supine high potential. So, I will be facing the client and I will be performing a triangle shape. So, gonna be palpate right here and observe for the necessary findings that I will send to you earlier. Now, I will be using a tape measure for the identify the pubic height measurement of the baby. I will be using the centimeter part to start to the superior to symphysis pubis, which is located in here. And we will be following abdominal curve. Remember that it must be dominant hand. For the next grip or second maneuver, which called umbilical grip, we're gonna be palpating on the side of the uterus. Now, in here, we're gonna be determining the fetal back because this is important for us to know where can be as to take the fetal heartbeat or the fetal heart rate. And the normal heart rate of the baby is 120/160. Now, I will be palpate right here and observe. So, my left hand will be stationary and my moving. So palpate from here and palpate from top to bottom. Vice versa. Now, my right hand will be stationary and my left hand will be moving. Top to bottom. Next is our third maneuver or third grips, which hold the codex grip. So in here, I will be performing an L shape on my hand, which is my index finger and my thumb. I will be placing it right above from the symphysis pubis of the patient. We're gonna be observing the degree of the engagement right here. So if this move, when you move it from side to side, or when you move it upward to the lip of the head, because some other institution do that, it means that the fetus head is not engaged. But if you not move it, it is movable, it means not engaged. For the last maneuver, we're gonna be a pelvic grip. For the first maneuver and second maneuver and third maneuver, we were gonna be facing the client. But the fourth maneuver, we're gonna be facing here in the foot. We're gonna be starting here, located here, and we're gonna be approximately 2 inches on the inguinal ligament. If you are gonna be palpating it downward motion in the side again, we're gonna be palpate it and then proceed to your assessment. Remember that we will be flex head is right opposite the fetal back. Once before you done our procedure, before you leave the patient, make sure that your patient is comfortable in her position. And do not forget to say goodbye and to tell your patient that we were done. I'm Miss Paula Juarez, and I am done the procedure that we will be doing today. And goodbye, Miss Paula. Since we're done, do not forget to wash your hand and note all unusual finding or any finding that you have found in your patient. Thank you.